Because the extent to which vaccines may prevent the onward spread of the virus has not yet been fully determined, this has to apply to everyone in Canada, including those of you who have received your first and even your second dose of vaccine.
Just under 15% of Canadians have gotten at least one dose of a COVID-19 vaccine. But public health and epidemiologists say we'll need both vaccines and strong public health measures to control the rapid growth of COVID's third wave. Despite mounting public frustration over continued lockdowns, one epidemiologist says if Canadians can hold on for just a bit longer, the finish line is in sight.
In previous points of this pandemic, the lockdown seemed interminable because no one saw an exit strategy. The exit is now clear. We see the exit. The exit is get the shots into arms sufficiently that no more infection takes place and that transmission goes down and that new variants do not emerge. That's the exit plan. It just needs time to work.
In total, about 7.4 million vaccine doses have made it to provinces and territories, a figure expected to reach 9.5 million by end of week. But growing vaccination rates are matched or exceeded by growing case numbers. Dr. Howard Njoo issued a warning ahead of the Easter long weekend, noting that previous holidays have led to avoidable surges in COVID.
Stay home. And only with the members of your immediate household. Even if you have family members, I think, in the same city, especially in a part of the country where there's obviously a resurgence, have a virtual celebration and connect through other means, but don't get together indoors, especially for the long weekends.
With frustration mounting over vaccine access and provinces blaming the federal government for short supplies, Public Health has released a province-by-province breakdown of doses delivered so far. This comes as Public Health confirms the Serum Institute will meet its Canadian contracts, but Indian export restrictions will delay delivery. Meanwhile, a delayed shipment of European Moderna doses is now on its way, while 1.5 million AstraZeneca doses from the U.S. are being distributed now. Dr. Njoo says he understands public fears over possible AstraZeneca side effects, but emphasized that the data says it works and is safe.
If you look overall, I would say that the AstraZeneca vaccine is safe and effective. 20 million doses plus have been administered worldwide, and only a few of these very rare side effects have been reported.
All this as Pfizer-BioNTech secures its status as the public's preferred vaccine, with new data from Pfizer's longest COVID vaccine study yet. Tracking nearly 12,000 people over 6 months after vaccination, the study finds that the vaccine is 91% effective at stopping COVID and 100% effective at stopping severe COVID. In Ottawa, Xiaoli Li, City News.